Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. For a rectal examination, the patient can be directed to assume which of the following positions. Option A. Genupectoral. Option B. SIMS. Option C. Horizontal recumbent. Option D. All of the above. Right answer is option D. All of the above. All of these positions are appropriate for a rectal examination. In the genupectoral, knee-chest position, the patient kneels and rests his chest on the table, forming a 90-degree angle between the torso and upper legs. In SIMS position, the patient lies on his left side with the left arm behind the body and his right leg flexed. In the horizontal recumbent position, the patient lies on his back with legs extended and hips rotated outward. During a Romberg test, the nurse asks the patient to assume which position. Option A. Sitting. Option B. Standing. Option C. Genupectoral. Option D. Trendelenburg. Right answer is option B. Standing. During a Romberg test, which evaluates for sensory or cerebellar ataxia, the patient must stand with feet together and arms resting at the sides, first with eyes open, then with eyes closed. The need to move the feet apart to maintain this stance is an abnormal finding. If a patient's blood pressure is 150/96, his pulse pressure is option A. 54. Option B. 96. Option C. 150. Option D. 246. Right answer is option A. 54. The pulse pressure is the difference between the systolic and diastolic blood pressure readings, in this case, 54. A patient is kept off food and fluids for 10 hours before surgery. His oral temperature at 8 a.m. is 99.8 F, 37.7 C. This temperature reading probably indicates option A. Infection. Option B. Hypothermia. Option C. Anxiety. Option D. Dehydration. Right answer is option D. Dehydration. A slightly elevated temperature in the immediate preoperative or postoperative period may result from the lack of fluids before surgery rather than from infection. Anxiety will not cause an elevated temperature. Hypothermia is an abnormally low body temperature. Which of the following parameters should be checked when assessing respirations? Option A. Rate. Option B. Rhythm. Option C. Symmetry. Option D. All of the above. Right answer is option D. All of the above. The quality and efficiency of the respiratory process can be determined by appraising the rate, rhythm, depth, ease, sound, and symmetry of respirations. A 38-year-old patient's vital signs at 8 a.m. are axillary temperature 99.6 F, 37.6 C, pulse rate 88, respiratory rate 30. Which findings should be reported? Option A. Respiratory rate only. Option B. Temperature only. Option C. Pulse rate and temperature. Option D. Temperature and respiratory rate. Right answer is option D. Temperature and respiratory rate. Under normal conditions, a healthy adult breathes in a smooth uninterrupted pattern 12 to 20 times a minute. Thus, a respiratory rate of 30 would be abnormal. A normal adult body temperature, as measured on an oral thermometer, ranges between 97 degrees and 100 degrees Fahrenheit, 36.1 degrees and 37.8 degrees Celsius. An axillary temperature is approximately 1 degree lower and a rectal temperature 1 degree higher. Thus, an axillary temperature of 99.6 degrees Fahrenheit, 37.6 degrees Celsius, would be considered abnormal. All of the following can cause tachycardia except Option A. Fever. Option B. Exercise. Option C. Sympathetic nervous system stimulation. Option D. Parasympathetic nervous system stimulation. Right answer is Option D. Parasympathetic nervous system stimulation. Parasympathetic nervous system stimulation of the heart decreases the heart rate as well as the force of contraction, rate of impulse conduction and blood flow through the coronary vessels. Fever, exercise, and sympathetic stimulation all increase the heart rate. Palpating the midclavicular line is the correct technique for assessing. Option A. Baseline vital signs. Option B. Systolic blood pressure. Option C. Respiratory rate. Option D. Apical pulse. Right answer is Option D. Apical pulse. The apical pulse, the pulse at the apex of the heart, is located on the midclavicular line at the 4th, 5th, or 6th intercostal space. Baseline vital signs include pulse rate, temperature, respiratory rate, and blood pressure. Blood pressure is typically assessed at the antecubital fossa, and respiratory rate is assessed best by observing chest movement with each inspiration and expiration. The absence of which pulse may not be a significant finding when a patient is admitted to the hospital. Option A. Apical. Option B. Radial. Option C. Pedal. Option D. Femoral. Right answer is Option C. Pedal. Because the pedal pulse cannot be detected in 10% to 20% of the population, its absence is not necessarily a significant finding. However, the presence or absence of the pedal pulse should be documented upon admission so that changes can be identified during the hospital stay. Absence of the apical, radial, or femoral pulse is abnormal and should be investigated. Which of the following patients is at greatest risk for developing pressure ulcers? Option A. An alert, chronic arthritic patient treated with steroids and aspirin. Option B. An 88-year-old incontinent patient with gastric cancer who is confined to his bed at home. Option C. An apathetic 63-year-old COPD patient receiving nasal oxygen via cannula. Option D. A confused 78-year-old patient with congestive heart failure, CHF, who requires assistance to get out of bed. Right answer is Option B. An 88-year-old incontinent patient with gastric cancer who is confined to his bed at home. Pressure ulcers are most likely to develop in patients with impaired mental status, mobility, activity level, nutrition, circulation and bladder or bowel control. Age is also a factor. Thus, the 88-year-old incontinent patient who has impaired nutrition from gastric cancer and is confined to bed is at greater risk. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share, subscribe our channel for regular updates.